Recording is on.
Along with restrictive or repetitive behaviors and interests and sensory problems as well. It is called spectrum because it affects individuals differently and to varying degrees. Autism typically appears in early childhood and can impact behavior, learning of child, and sensory experiences throughout the whole life. Uh, in the introduction, I would say autism spectrum disorder and religion intersect in complex and multi-faceted ways, reflecting the diversity of experiences among autistic individuals and the variety of religious traditions worldwide. While religious communities can provide meaning, structure, and of sense of belonging, autistic individuals may also face barriers related to communication, sensory sensitivities, and social interaction in these settings. What are the objectives of of my presentation? This presentation aims to explore the dual role of religion, which can play in the lives of autistic individuals, both spiritual enrichment and potential exclusion. Uh, it highlights key areas of challenge and opportunity for greater inclusion in religious life. I'm sorry, but I will turn off my audio sounds because there is too many noises in the background. The theory of atheist autism, religion and spirituality require the ability to mentalize understanding intentions, emotions, and purposeful thoughts in others. Individuals with autism struggle with this cognitive function, leading to difficulties in engaging with religious beliefs in traditional ways. Cognitive science of religion and autism is about three cognitive tendencies. It's a byproduct. First, hyperactive mentalization, attributing mental states to explain behavior. Teleological reasoning, attributing purpose and meaning to objects and events, and agency detection, assuming that entities with intentions act in the world. Now I will explain something about theory of mind, the TOM and autism. TOM or mentalization refers to the ability to attribute mental states to oneself and others. Affected brain regions in ASD, medial prefrontal cortex, posterior cingulum, and the temporoparietal junction. This is some parts of the brain. Classic studies show children with ASD that struggle with TOM tasks. Some meta-analysis findings show that ASD individuals perform worse TOM tasks, especially in reading and complex scene comprehension. TOM deficits are common in ASD children, as measured by conventional tests closely tied to language, communication, and social adaptation as well. Individuals with autism spectrum disorders display a considerable variety in TOM depending on the task used. TOM abilities fall on continuum, manifest differentially, and do not fully explain the symptoms. And now, what is the connection with theory of mind and religious cognition? TOM enables humans to attribute mental states to supernatural agents, gods, spirits, angels, etc. Supernatural beings are often counterintuitive. Example, gods knowing everything. The PET model of religious cognition places TOM as the first step, followed by body-mind dualism, soul and body as separate. Teleology belief is about belief that things have inherent purposes. Second thing, the role of TOM in religious practice. TOM facilitates joint religious rituals, chanting, and social synchronization. Ritual participation can lead to altered states of consciousness that strengthen social bonding. Religious experiences go beyond cognitive faculties influenced by culture, social interactions, and history. Third thing about theory of mind and religious cognition is about limitations. TOM does not directly cause religious beliefs. Other factors shape spiritual thought. The human experience of meaning, emotional atonement, and absorption plays a major role. Emotional empathy and TOM should be distinguished. Emotional empathy is positively linked to religiosity, and cold TOM may be unrelated or even negatively correlated with religious belief. Alternative perspectives on religious cognition are about children's understanding of divine minds is based on learning ontological knowledge, not just about social cognition. Recent critics argue that TOM alone fails to account for religious diversity and spirituality. Religious thought emerges from an interplay of cognitive processes and cultural influences. The concept of inclusion probably is very well known to you, who are there in Krushevo, and also for presenters online. Inclusion is adapting environment, not just individuals. Difference between inclusion, integration, and assimilation. We should be aware about them. And inclusive communities celebrate neurodiversity. Neurodiversity is one movement in the last 10 to 15 years worldwide. Why religion matters? Source of meaning, morality, and belonging is important here. Participation in faith and enhance well-being of the child with autism, and often a central part of family and community life. Challenges in religious setting, sensory overload, light, sound, crowds, abstract thinking, or metaphorical language are very difficult for children with autism. Unspoken social rules and exclusion from rituals or sacraments. Misconception and stigma are also important in children with autism, because autism misunderstood in some religious contexts could be a problematic. Myths, there are a lot of myths: spiritual deficit, punishment, or lack of faith. Importance of dismantling stigma. Spiritual strengths in autism appreciate the children with autism are very strong with structural things, ritual, moral clarity. We should explain them about that. Unique perspectives on theology and meaning are very difficult sometimes to them. Abstractive concepts are difficult because their thinking is more on a concrete level rather than an abstract level. Capacity for deep spiritual connection. Sometimes some of the children have a capacity for deep spiritual connection. Families and caregivers, they experience judgment or lack of support in the society, and we should support them, the whole society, not only we as experts. Need accommodation to attend services and role of religious communities in supporting them. We should conduct training for faith leaders. Faith leaders play a crucial role in fostering inclusive religious communities. Training them to support autistic individuals requires a multifaceted approach that combines education, collaboration, and advocacy for the neurodiversity. We should give training about autism awareness. faith leaders should receive structured training to understand ASD and its impact on social interaction, sensory processing, and communication. And training should cover core characteristics of ASD, sensory consideration. Faith leaders should learn strategies to make services more accessible. For example, providing quiet spaces in the churches or other places, reducing bright lighting, offering sensory-friendly services, etc. Also, understanding communication differences, because one of the main problems in children with autism is not non-appropriate communication, verbal or non-verbal. Leaders should learn to use clear, direct, and structured communication to improve accessibility. Breaking stereotypes and misconceptions, some religious communities mistakenly associate autism with spiritual deficiency, lack of faith, or divine punishment. Training should focus on dismantling stigma and promoting understanding of ASD as a neurodevelopmental condition, not a moral failing. Collaboration with families and professionals. Faith communities should actively engage with autistic individuals and their families to ensure religious settings are welcoming and accessible for them. Listening to autistic individuals and caregivers, understanding their specific needs in religious services, events, and rituals. Promoting neurodiversity as a theological value. Neurodiversity should be embraced as part of the religious community's moral and ethical framework. Training should highlight theological perspective on inclusion. Many faith traditions emphasize compassion, justice, and belonging, teaching leaders how religious texts and traditions support neurodiversity can help shift attitudes toward inclusion. Also, autism-friendly theological interpretation. Some religious teaching rely on abstract metaphors that may be difficult for autistic individuals to grasp. Faith leaders should explore concrete explanation and inclusive approaches to scriptural interpretation. And finally, I'm going to conclusions. Religious inclusion matters. Faith communities can be vital sources of belonging, identity, and support for autistic individuals and their families. Barriers exist but are not surmountable. Sensory, communicative, and social challenges can be addressed with understanding and simple adaptations. Autistic individuals have spiritual depth. Many find meaning and connection through faith, ritual, and teleology. And inclusion benefits everyone. Creating a welcoming environments enhances the spiritual lives of all members of religious community. Faith leaders and communities must take the lead. Training, open dialogue, and respect for neurodiversity are key to building truly inclusive spaces. Me, as a president of Macedonian Scientific Society for Autism, and also my colleagues, we are available for all faith leaders if they need our support or our training skills. So this is the last slide. My contacts are here. I would like again to thanks to organizers, to Ivana and Professor Matersky for inviting me of this important conference. And also, I'm excusing myself because I could not be with all of you at the discussion session because you made some changes in the program, and the program is delayed 1 hour and 1.5 hours. So I plan to finish after maximum at 2 o'clock Macedonian time, but probably you will finish approximately around 3:30. So in the time I have another obligation. So please excuse me. Thank you very much for your attention.
Thank you. You were perfectly in time. So And we go on with the next speaker. Is this the one from South